What would you do if your food was the one slowly eating the years of your life away? Or if you had to take the chances of consuming something contaminated with every pill that you take? Well, that's what we'll be diving into. Good evening, my name is Lennon Sloan, and with the abundance of sources like government reports, expert opinions, and investigative journalism, we will be discussing the FDA's failures. The FDA's failure to prioritize consumer safety over corporate interests has led to dangerous lapses in food and drug regulation, impacting the health and safety of Americans. In this presentation, we will be looking over examples of FDA's failures and impacts, the causes of such regulatory failures, and a call to action for reform. Now, if you're unfamiliar, you may be wondering what even is the FDA? Well, the United States government answers that question via USA.gov. The Food and Drug Administration, the FDA, is responsible for protecting the public health by assuring the safety, efficacy, and security of human and veterinary drugs, biological products, medical devices, our nation's food supply, cosmetics, and products that emit radiation. Now that you understand the idea of the FDA and its purpose, we will be discussing its failures and impacts. The FDA has had various instances of contaminated food and drugs, but two specific cases include the outbreak of salmonella contaminated onions and the contamination of generic Aleve. First, Politico's extensive investigation on the FDA, a political journalism organization covering politics and policy, provides the statistical impact of the salmonella contamination in 2020, with 1,127 people sickened and 167 others hospitalized, followed by an extremely late recall issued on August 1st, more than a month after people were falling ill. Additionally, later in May of 2021, people suffered from this same exact situation, with 1,040 people falling ill and 260 people ending up hospitalized from salmonella-contaminated onions. Multiple recalls were issued more than 4 months after people were falling ill. Secondly, Fair & Lawblock, a personal injury law firm, provides insight into the 12,000 boxes of generic Aleve, also known as naproxen, that were actually ibuprofen. That is one of the many examples included with the 65 drug-making facilities recalling nearly 300 products within 12 months of the facility passing an FDA inspection. Such FDA failures have impacted not just random individuals or those who are older, but even families, with children suffering the same consequences they never should have to suffer. NBC News provides a personal and emotional insight with Alicia Moreno, mother of Anderson. While sleeping next to her son's hospital bed, waiting for him to be taken up for his heart transplant, she was broken with horrible news after being woken up by a doctor who claimed the stool softener her son used was contaminated with a bacterium. He was temporarily taken off the list for a heart transplant, but after his transplant, the same bacterium resurfaced, combining with a flu-like illness to infect his lungs, leaving him on a ventilator ever since. His mother states, quote, "Something that was supposed to help him hurt him." There have been many examples of lapses in quality control, reaching far back and all the way to the present. As provided by SGS DigiComply, an all-in-one food safety and regulatory compliance platform, some further examples include FenFen, leading to thousands of lawsuits and a loss of public trust. Vioxx, a pain reliever, later found to increase the risk of heart attack and stroke. And thalidomide, marketed as a sedative and anti-nausea medication for pregnant women, found to cause severe birth defects. The Journal of Ethics, a collection of peer-reviewed articles, discusses regulatory failures and marketing impacts. As stated, the National Academy of Sciences publicly called on the FDA to overhaul its opioid policies, in addition to aggressive opioid marketing. Furthermore, despite extensive criticism, FDA policies for approving and labeling opioids remain largely unchanged. Not only that, but there has been no analysis of its regulatory errors that contributed to this public health catastrophe, let alone have they instituted any major reforms. Now, onto the topic of causes or tracing the roots, which we will swiftly go by to reach our call to action. The FDA's 1992 user fees law enables the FDA to collect large user fees from pharmaceutical companies or device manufacturers seeking approval for a new drug or medical device, as stated by Fair and Law Blog. These institutes are paying big money to get through the approval process, with the result being more new drugs way faster. But are they better? Is the FDA allowing itself enough time to conduct thorough analysis? Are they safe? I'm sure you can piece that together. The National Center for Health Research speaks about eroded scientific standards, with the mention of how it has only become worse since 2016, with the passage of the 21st Century Cures Act, which gives the FDA enormous leeway in what kinds of studies it demands of companies in order to get their drugs approved. Stephen Goodman says the FDA needs flexibility, who is the Associate Dean of Clinical and Translational Research at Stanford. But it has been erring on the side of lowering the scientific bar. House Committee Chairman James Comer critiques the FDA's delays and safety lapses, as provided by the Committee on Oversight and Accountability. His opinion substantiates the failures and need of reform regarding the FDA with a governmental view, proving the issue to be more than a typical civilian argument that could be seemingly biased. He states, further, the FDA's failure to regulate has allowed unsafe and illicit products to proliferate. On top of that, the argument presented by the Journal of Ethics highlights that the FDA underestimated the addictiveness of opioids, prioritizing pharmaceutical profits over public health. Long-term use has been affiliated with addiction, respiratory depression, neurodysfunctions, and other medical problems. So, why is reform urgent, and what can we do? Well, these lengthy recalls and outbreaks, detailed in Politico and DigiComply, emphasize how delays harm public trust and safety. Now, what we can do is propose reforms such as increased transparency, stricter scientific standards, and reduced financial influence from corporations. Further, we can encourage advocacy for opioid labeling reform as recommended by the Journal of Ethics to prevent future crises. The FDA's consistent regulatory failures are systemic problems that demand urgent reform. The devastating impacts of FDA failures, the underlying causes, and the need for action hopefully inspires you all to push for the FDA accountability, advocate for better regulations, and educate others about the role of the FDA in protecting public health. Thank you so much for listening.